Hi, everyone. Welcome to Concussions Women podcast, a series hosted under the Concussion Talk podcast by founder Nick Mercer. My name is Dr. Allyssa Memmini, and it is my honor to host this critical series highlighting differences in injury management and support for women who sustain concussions. Today, I am joined by Dr. Kristen Schuyten, who's owner and a physical therapist with Perform Well PLLC and is faculty with the University of Michigan Department of Dance. She's also a physical therapist with the Wellness Initiative with the University of Michigan School of Music, Theater, and Dance. She holds her board certification in sports through the American Board of Physical Therapy Specialties and is certified strength and conditioning specialist through the National Strength and Conditioning Association. She performs faculty and staff training in concussion and emergency management of the performer, screening, and treatment of performing arts patients, and coordinates and performs on-site triaging, backstage treatment services for the University of Michigan. She has developed a post-operative protocol for returning to dance, a post-concussion return plan for university performers, and injury risk assessments for figure skaters, gymnasts, and instrumentalists. For over 15 years, she has coordinated musculoskeletal injury risk screening and neurological baseline testing for the University of Michigan, including analysis of individual screenings and customized exercise prescription. Dr. Schuyten has been a volunteer physiotherapist for the U.S. Figure Skating National Medical Team since 2013, coordinating care for local, regional, and national figure skating championships, as well as providing support for the team during Olympic and World Championship events. Dr. Schuyten has delivered presentations at both national and international conferences focusing on concussion, injury risk assessment, and wellness related to the performing arts. She is a member of the Faculty Council at the University of Michigan Concussion Center and has co-authored several papers that highlight research regarding post-concussion, return to learn, and return to performance progressions for university students in the performing arts. Lastly, she provides lectures and workshops on these topics at other colleges and universities, dance studios, skating rinks, and even online educational modules regarding performing arts rehabilitation. Dr. Schuyten, welcome to Concussions and Women podcast.
Welcome. Thank you for having me.
So before we dive into your research and clinical
Mhm,
practice, can you
mhm.
tell us a little bit about your backstory? How did you get involved in physical therapy?
Yeah, so it's interesting because I was not meaning to go into physical therapy whatsoever. When I started out, I got my undergrad from Michigan and started out in the College of Engineering and know I loved math and science, and then realized after 1 year into it that my brain did not function like how an engineer's brain would, and had to switch majors and was trying to kind of figure out what made the most sense for me, realized how much I loved psychology, still wanted to be
Mhm.
into the sciences, and just kind of happen chance went into one course. It was a practicum in sociology where I got connected with physical therapy in the gym setting within the University of Michigan Hospital and realized, okay, this is actually a really cool thing. I had been a PT patient when I was in high school and I was doing track and field and got some hamstring tendonitis and didn't really even think about it being an option then. I had had family members that were in healthcare, but didn't really think I was going to be in healthcare myself. And then went through, did more volunteer work and working with the pediatric neuro rehab that was, dealing with kiddos, but also collaborations with recreational therapy, occupational therapy, PT, obviously, respiratory therapy, everything with these kiddos. And it was just really amazing being able to see all these different disciplines working together,
Yeah.
and kind of went on the path then of going in through PT and having the background. My major was cognitive, looking at biopsychology and cognitive science. That combination of biology plus psychology has really been helpful with being a physical therapist, but also
Mhm.
especially with some of then the specialties that I'm currently pursuing and looking at, whether it's concussion or working with performers. Having that background has been really, really helpful.
Yeah, and I think it's actually really interesting that you went into engineering at first because
Yeah.
I mean, thinking about physical therapy and thinking about biomechanics, physics really
Yep.
does lay the groundwork for
Yes.
understanding how the body moves. So I can totally see those similarities in terms of your coursework and how
Yes.
you kind of came onto that trajectory.
Yes.
What do you love the most about your job as a physical therapist?
I really love the relationships that I
Mhm.
make with the patients and their families. I have been a PT now for 20 years, which seems crazy to me. But I've had some of those patients for a good portion of that 20 years. And I've had so many of my patients too. I count on multiple hands how many patients I've had, especially some of the performers that have started out as kiddos. And then I've been able to, work with them all the way up through their teenage years into college years. And I've had that many that have been inspired by PT because of either work with me or work with some of my
Hmm.
colleagues to pursue that field themselves. And I've went through, and there was a conference that we had that was in Columbus, Ohio, so it was close to Michigan, and dealing with dance medicine science back a couple years ago. And I want to say maybe 6 or 7 of my past PT students were all
Oh my
there.
gosh.
And a few of those students I had as patients back in the day. And
Wow.
so I kind of felt like a mother hen. I was here with
Yeah.
all of my past students. And then I'm looking through, and I know that it has been kind of a topic of conversation with whether I'm writing recommendation letters for them or they're getting observation hours with me, just
Hmm.
kind of this whole trajectory of them starting out as patients and then me helping to guide them and answer any questions they have, or continuing education to be able to go into things like performing arts or sports specific, and
Hmm.
then them now being practicing professionals. It's been really cool to see how all of that transpires, but then it also makes me feel a little old when I look at how many people that then have followed that path, but also, it's been cool to be part of that journey for them.
Yeah, that is really cool. And now they've become some of our research
I
collaborators,
know,
which is even
exactly,
better.
which has been amazing.
So, yes, that's amazing. Thank you. So I'm going to be shifting into kind of more into your clinical practice. So, with your bio, it's clear that you work with a lot of different sport entities. I know you work with both male and female patients, but it seems like it's
Yes.
probably more female dominated.
Yep.
So I'm curious to your thoughts on what are some of the differences just working clinically with these patients that you notice between female and male patients when it comes to like concussion education, recognition, disclosing the injury to you, and even recovery patterns.
Well, I can to start with the last one first. I have
Hmm.
definitely seen challenges with recovery and how long it's taken for some of our females.
Okay.
And again, I would say because I do a lot of work in dance and figure skating that is much more female heavy with the representation, that I'm seeing this and it's going beyond what the norms are for the sports
Mm,
populations. And it may
sure.
be having to do with the demands of what they have to get back to, but also the patient age and activity level. They're young, they're healthy, and for it to then be concerning for how much they're delayed, then it gets to be like how you had noted about maybe there's challenges with the education or reporting that they maybe feel like they can't report and they have to push through things.
Mm,
And it's been tough to be able to, start things kind of from scratch with some of these programs that we're trying to do. But
mm,
I think there's been buy-in, even if it's been resistant at first, to be able to get things started. But I would say maybe females more than males feel maybe that they can talk about things and that they
mm,
may feel more comfortable talking with healthcare providers versus the males that maybe don't report as easily.
mhm.
But from performers and some of those more performing art type of sport athletes, we're seeing this as a disconnect, possibly because they're not having as much support right on site. And so that may just
Okay.
take them longer to be able to report and get seen. They have
Mhm.
to manage going through all the different hurdles and hoops with healthcare to be able to do that. But those are kind of some of the trends that I've seen through the years.
Yeah, definitely. Similarly, I'm just thinking about just you have so many different levels of teams that you've worked with in terms of
Mhm.
amateur, recreational, all the way
Yep.
through professional athletes. Do you notice differences specifically with the female patients, differences in injury reporting depending on the level that they're at? And how do you address that? Because, if they're at the Olympics and they may
Yeah.
have a concussion, how do you manage that as a physical therapist?
Well, when they're at a high stakes competition, most times when they're with a governing body like US figure skating or USA gymnastics, they'll travel with healthcare providers, whether that
Hmm.
is a physician, whether that's an athletic trainer, a PT. So they have people that are available and accessible for them to be able to not only see what's happening at practice and competition and kind of have that eyes on the ice, but
Hmm.
also they can help them out immediately with going through different types of assessment tools or treatment strategies. And so it really does help to hasten that process. Now, when it's
Hmm.
outside competition, especially an elite level competition that may have providers that are traveling with them, then it gets to be a little tougher because they just don't
Right.
have that direct access. They don't have people that have seen, like a healthcare provider that has seen what just happened. So they know the
Hmm.
mechanism of injury. They know all the variables that went into it. They know if they maybe got back up and kept skating, all of
Hmm.
that. But two, they just may have a really busy schedule and they may kind of put it as a lower priority getting checked out until they really can't participate in their training anymore. And by
Hmm.
then, we know that if they're continuing to train when their brain is healing, it may then just lengthen the recovery that much further because they just didn't get it checked out in the first place.
Hmm. Yeah, definitely. What do you believe are some of maybe the unique challenges our female patients might experience more than our male patients during that concussion recovery? Is there anything that might predispose them or things that
Oh, yeah.
clinicians should keep in mind
Yeah, there.
as they're working with female cohorts to think about, especially as we have patients that have those persisting post-concussion symptoms?
Yes, there's quite a bit. I mean, we see things popping up in the research, and it's tough because I don't think that there's nearly as much done as what there needs to be.
Hmm.
But we see things having to do with how lax their ligaments are, how weak or low volume their neck strength is. I would say one of the things that I found really interesting that just really hasn't been dove into. We know a lot of research that's out there with hormones and the relation that it has to increased risk of ACL tears, but they really haven't done anything having to do related to concussion. And so when we look at that, like, okay, we're trying to make these inferences based on what's done in the research from ligament laxity having to do with ACLs. And then they
Hmm.
did start to find out some things having to do with like low back injuries, but okay,
Hmm.
how is that connecting up to the neck? How is that connecting up to any of the surrounding areas that could potentially absorb shock from something like a concussion? So I think that there's a lot that could potentially be contributing to it. And then when you look at the combination of variables, it's not just for some of our females that are then going through the menstrual cycle, it's also our pediatric, our younger ones that then may be having some issues and concerns. They may even have more lax ligaments because
Hmm.
they're kiddos. And then we come into some of our females that are older. I mean, I know adult skaters that are, I have covered competitions. They are in their 70s and 80s and they are
Wow,
still skating. And so we look at that
amazing.
and like, we we just know that there's obviously an increased risk of things like musculoskeletal injuries that are
Right.
happening, but there's also then this challenge of, okay, what happens if they have a fall and they hit their head? Or they have something like a fall on an outstretched hand, and then those forces get translated
Hmm.
up through the arm into the neck and the head. And then, they're postmenopausal, what's happening
Right.
with their hormone levels with that, with challenges with bone health, with muscular health. I mean, there's so many other than complicating factors that could
Hmm.
increase the risk that much further of having either a more severe injury or a delayed recovery.
Hmm. Definitely. And I think the conversation about menopause has expanded infinitely,
Yes.
really over the past 10 years. And even talking about perimenopause, we really
Mhm.
don't understand how that affects our bodies, especially um, as a potential risk factor for concussion with the fluctuation of sex hormones and things like that. So
Yes.
it'll be interesting to see what that looks like in the future.
Well, and it's not even looking at some of the ligament content and what happens with estrogen and how that increases ligament laxity, but progesterone in itself, which estrogen and progesterone both tank as we're going into menopause.
Right.
And so with that, it's like progesterone has been shown to have a neuroprotective effect. It's helping us, it calms us, it decreases our anxiety, just puts us in a little bit better mood. But then once that's gone, once that's really low numbers, then unless you're doing something like a hormone replacement therapy, and then the risks that then go with hormone replacement therapy on top of it, where
Hmm.
are your levels at?
Hmm. Absolutely. I was just thinking about HRT almost
Yep.
as like a potential treatment avenue because as you've been describing, concussion really overlaps with so many other types of conditions. When we
Hmm.
think about cervical laxity, for example, the
Yep.
National Athletic Trainers Association just put out a bridge statement in 2024, really emphasizing not only that initial cervical spine assessment, but recurrent assessments. And I
Yep.
think clinicians really need to think about that, especially if they're having a lot of those common symptoms like dizziness or,
Yep.
feeling faint and things like that, that could maybe actually be contributing from the cervical spine rather than the concussion itself, or maybe exacerbated by the concussion.
Yeah. And it's tough for us because even when we go through with some of these performers, I mean, I can tell you
Hmm.
we have with skating, they'll go through at the elite level and they'll do something like a physical when they are at a junior senior level and they are with the national team. They'll go through and do
Hmm.
that once a year. But if you're not at that level, are you getting a physical done? And is
Right.
anything related to it having to do with your head and neck or concussion risk?
Hmm.
And what we do with our performing arts university students, we do perform a neurological baseline, but only on the incoming freshmen.
Hmm.
And if anything were to happen beyond that, again, if this is something that should be done on a recurrent basis, you also need to have the staff and you need to have the funding available to be able to support that
Yeah.
because we know that things can change, whether it has to do with hormone levels going through puberty or if we know that
Hmm.
something's happening when they're on an oral contraceptive pill or anything in between there that could potentially contribute to changing up the variables that unless
Hmm.
you're having that recurrent type of testing done, you really have no clue what you're working with as a baseline. And then,
Right.
especially if an injury were to happen, what that may result in for recovery.
Well, this actually goes right into my next question. So we
Yeah.
must be on the same wavelength.
Yeah, there you go.
Um, Thinking about this conversation, how do you believe clinicians, whether it's an athletic trainer, physical therapist, anyone who's working with these different entities, how can we better support female patients after concussion?
I think having some of these conversations,
Hmm.
and again, it's tough sometimes because I don't know many teen or early adult females that track their periods. I don't know many that maybe know, unless they have had that diagnosis in the past, that they
Mm.
may be hypermobile. And so, or if they have a family member that might have like EDS or something, knowing that, okay, I have some hypermobility that runs in my family or some of these connective
Hmm.
tissue concerns. So I think any of the variables that could increase risk, they may not have ever had those conversations. And so starting the conversation can be really helpful. But I think
Hmm.
also, too, when we just know that things like having increased vestibular symptoms immediately after concussion can increase your risk of having a longer recovery time,
Right,
that
exactly.
setting the stage from the get-go, that if we know that you have this dizziness, we know that, when you go through some of this VOM assessment, that you're having some of these tests markedly increasing your symptoms, like don't continue to tell them you're gonna be, all good to go within a week. Like maybe trying to set the stage that this may take a little bit longer, that if it takes less time, then great, but also really, pushing the importance of following a specific protocol
Right.
and having a stepwise progression to return after. And it doesn't just have to be for a high level athlete, it doesn't have to be for a high level performer. It can be from anybody that's just trying to get back to everyday activities, because
Hmm.
you don't really realize how challenging it can be on your vestibular system, on your balance, just trying to turn your head to look behind you in your blind spot. I mean, there's small things that can even
Right.
just, your kiddo calls at you and you're trying to go down some stairs and then you fall over. So there's things that are just everyday activities that could potentially exacerbate some of these symptoms in a very, it's sunny outside, loud noises, like the fireworks
Hmm.
coming out. I mean, anything like that could have the potential of increasing some of your symptoms after having concussion. And so trying to make sure that you're following that stepwise progression, that you're keeping track of your symptoms and you're
Hmm.
communicating with your healthcare provider. And then same thing from a provider standpoint, that you're, really having that open conversation with your patient. And if it ends up being that you're working with them and they're not getting better, or they may benefit from vestibular, or they may benefit from more specific cervical types of
Hmm.
physical therapy, or even just further testing, then being okay with referring back, because
Right.
sometimes it's outside our wheelhouse and we need a little bit more assistance to be able to help progress the patient.
Absolutely. And something that I teach my athletic training students is don't let your ego be bigger
Yeah.
than
Yes.
what the patient needs, right? So
Yes, exactly.
have humility and
Mhm.
recognize that this is beyond my scope, or I have a
Yep,
great resource within my community that would really benefit my patients.
exactly.
Similarly, I'm curious if you have any specific assessment tools beyond, our typical concussion multimodal assessment that maybe could be helpful in identifying, you talked about hypermobility and some of those connective tissue disorders. If there's anything that clinicians should be aware of that maybe they could incorporate if they were to do like a
Yeah.
baseline assessment in addition to our standard concussion practice.
Yeah, I mean, what I've started to do, and I think this is something that we're going to probably get a little bit more regular in doing for our incoming freshman class coming into this fall, is just a Baton hypermobility screen, which has 9 different points of the body that you can do within a couple of minutes. And we had already been
Okay.
putting a couple of tools in it. And basically, with your knees straight, can you touch your hands flat down to the ground if you're bending forward?
Hmm.
Do your knees hyperextend, both your knees, and how does that look? Do your elbows hyperextend, and what does that look like from a measurement? Can you touch your thumb like back down to your forearm, which I can because I'm a little hypermobile. And can you do that on both sides? And then same thing for your pinky finger. Can you go past the 90 degrees if your hand is flat on the table and trying to do that extension? So those are some easy ways to be able to see, okay, and also knowing some of the norms for our kiddos. They are
Right.
usually really hypermobile. And so if
Right.
they're, out of those 9 tests, if 5, 6 of them are showing up that there's a lot of laxity there, then it may qualify as a hypermobility. If we
Mm.
have one of our more mature patients that maybe in their 50s and 60s, like if they're ranking up and they're, hitting all these markers, then they're really hypermobile because usually as we get older, the tissue tightens up a little bit.
Okay.
But if they're still showing that they have that laxity throughout, then it gives us some good indication of where they stand in that hypermobility spectrum.
Yeah, absolutely. My last question for you is kind
Yeah.
of just to bring it all together. What is a key takeaway that you would like clinicians, even students who are wanting to pursue physical therapy or really any other allied healthcare program, what would you like them to remember from this discussion or to think about as they are working with performing artists, figure skaters,
Yeah.
gymnasts, instrumentalists, everyone in between with the performing arts?
Don't let their specialty scare you because it gets to be, I mean, I have a background in dance. I
Mm.
cannot skate backwards. I only ever owned, or not even owned, I've only worn a pairs of like of rental skates. And so I can barely do anything on a pair of skates.
Yeah.
But I think in looking at working with these populations, if you're interested in working with them, or if you have one on your schedule, then you're just like, I have no clue what to do. I can't
Hmm.
speak the same language. What does that look like for me? Are they going to think that, imposter syndrome starts to set in, whatever, that all these athletes, all these performers want is someone that can look at what they're doing, assess what they're
Hmm.
doing, and be able to help get them better. And so if
Right.
you're able to do that, no matter your background, and sometimes, I mean, again, my background is more in dance, and I've been able to apply my background in dance and working with skaters and gymnasts and cheer and musicians, even too. And background is in sport. There's a lot that performing arts can learn from sport, just like there's a lot that sport can learn from
Absolutely.
performing arts. And so if you can use any of that past, any of your background, any of your education in being able to treat them. I mean, really, if you look at some of their movements and video, use it, having an appreciation for what
Yeah.
they do and a want to learn more can be very helpful. But video can be so good. Just get what they're doing on video,
Right.
slow it down, break down all those different joint movements, and put it into exercise. I don't want to say
Right.
it's not rocket science, but it's one of those things that like really, if you have the passion and you want to learn more and you have an appreciation for what they do and you don't minimize anything that a performing artist does, then they're going to love you. So, but it also, you have to be able to follow those patterns. And it's tough
Hmm.
even as a healthcare provider. I've had some concerns come up from the performers that they have had conversations with a physician or, even someone in
Hmm.
the ER or something like that, that look at what they do as more like a hobby versus something because
I see.
they're not a regular athlete, and they feel minimized, and that automatically is going to diminish your rapport with the patient.
Of
So,
course.
being able to have the open mind, wanting to learn about it, seeing it
Hmm.
on video, breaking it down, that
Hmm.
can be so, so helpful in gaining that.
Yeah, so it sounds like just ask questions, be
Ask
curious,
questions.
work
Yeah.
with the patient. Yep.
Yes.
I think those are all great points
Yep.
and something that I think a lot of clinicians will take home. So thank you for sharing.
Of course.
Well, Dr. Schuyten, it was a pleasure speaking with you today and
Thank
learning more
you.
about your clinical practice and all the amazing things you're doing with research, supporting female participation in sport and performing arts. It really is a pleasure to speak with you on this podcast as a collaborator on our research, but also as a
Yes.
friend. So thank you for taking the time. Thank you all for listening to the Concussions and Women podcast. Please make sure to like and subscribe to the Concussion Talk podcast to stay up to date on the latest discussions on concussions.
Thank you.